What it do, Dream Team? It's your boy D Neal back with another reaction video, guys. Here we are with what the U.S. can learn from Australia's hybrid healthcare system. Before we dive in, y'all know what I'm going to ask y'all to do is to dive into that subscribe button, to ring that notification bell, to get a video a thumbs up so it gets suggested. What we got?
We continue now with our series on universal health care. As the United States struggles with the most expensive health care system in the world, some have started looking to Australia. William Brangham and producer Jason Kane report on how that nation has achieved universal coverage at a lower cost. Their story was filmed before the pandemic began.
Hello! Yes, and Australia's got a good system over there. Like I say, no system is perfect. Every system has its problems. But I feel like just in America, you know what I'm saying? We're just paying way too much. Like, you know, people should not be going into bankruptcy over healthcare. And not this many people. There should not be this many people still uninsured. It's these prices are just ridiculous. They're ridiculous.
Don't be fooled by this happy scene. This is a family divided.
You look lovely.
Oh, wow.
Thank you so much.
Okay, it's not quite that serious, but the division is stark when it comes to, of all things, health insurance.
Really?
On one side, Theophany Elisara and her husband Paul Dunn rely on Australia's public healthcare system. It's known as Medicare, it's paid for by taxes, and it's available to all Australians and permanent residents.
Oh yeah, no, we talk about that all the time.
That public system has gotten them through some pretty traumatic stuff. IVF treatment and a hysterectomy for Theophany, and for Paul, brain surgery to remove a malignant tumor. At first, they panicked over what they feared would be a huge price tag.
I was really scared. I was like, what am I going to do? Do I need to start a GoFundMe, which my friends did for me and my family did for me anyway?
But then you found out that the public system was going to cover a majority of that.
Majority of that, yeah.
Well, covered all of it.
Covered all of it, actually.
The whole surgery? The public system covered the whole surgery, covered her hysterectomy, covered it's an IVF or another problem she was. That's crazy. That's what's needed. However, sure, you pay a little more in taxes. I understand. You pay a little extra. But you know what I'm saying? To know that you can have this life-saving surgery and not be bankrupt for the rest of your life trying to pay back these debts, like, bro, that's so relieving. To know that, hey, when I'm sick, I can call up the hospital and not have to worry about some huge bill. Relieving.
Yeah.
Well, covered all of it.
Covered all of it, actually.
Wow.
On the other side, Paul's parents, Carol and Ross, are evangelists of the private sort.
Ancillary is good too. You get $2,000 worth of dental.
They skip over the public system and buy their own private insurance coverage. About half the country does this.
Okay.
Carol recently had her knee replaced and said she got great care and terrific perks. She says if she'd been in the public system, she'd still be in agony on a waiting list.
Well, I'd be crippled, really, in one leg.
This hybrid system, with the public Medicare system as a base, but then layered with private insurance on top, is by design. They're meant to work together, with the private system taking pressure off the busier public one. This unique setup meets two basic values, says health economist Rosalie Viney.
Just as one of the tenets of Australians' beliefs is that they should have access to public care, there's also an element that choice is part of what a lot of Australians seem to value.
Help me understand.
So it sounds like, so the parents, you know what I'm saying, they have private health insurance. She was talking about getting $2,000 off on dental and all of that, which is awesome. Because public health, does that cover dental or vision, or does that do you have to pay for that out of pocket, or you have to pay for private health insurance to cover that? I'd be intrigued to know that. But then she was talking about getting her knee replaced in the private health care system. Took great care of her, got it replaced, all great. Whereas she said if she would have been in the public system, she'd still be on the waiting list. She'd still be crippled right now. But it didn't seem the same with my guy having to get, was it a tumor in his head, or the girl having to get a hysterectomy, and they are both in the public system. So it's like, Huh. I don't know. You just got both of them sitting on opposite sides of the table. I think it is great to have a hybrid system, like they said, for the private healthcare system, to take pressure off the public healthcare system. I think that's a great thing.
If you have a system where any person, any Australian, can go and get free care from their GP or at a public hospital, what is the rationale for private insurance? Why would I, as an Australian, ever want to pay extra if I can get it for free?
So some of it is about access to elective care at the time when they want it. Some of it is about access to the amenities that a private hospital might offer.
Amenities
some of it,
like?
A private room, better food, those sorts of things, you know, choice of menus. Some of it is about choice of your own doctor, but some of it is actually about getting quicker access. So waiting lists can be long, and particularly for elective surgery, waiting lists in the public system tend to be long.
The whole sense of waiting for me, like with endometriosis, you could be in bed like chronic pain. So that could mean a year without working, 2 years without working, and it's just, that's not feasible either. So
a private health plan makes sense for Sarah Kozicki. She's training to become a nurse, and every couple of years she needs a costly surgery for endometriosis, which is a painful disorder involving the uterus.
So for that, I choose to have private health insurance that I can go and have surgery when I need to have surgery. I can do it in a private hospital or do it in a public hospital as a private patient, and I get to choose my specialist.
Okay. So you understand the benefits of private. Get to choose your own doctor. You don't have to wait on these waiting lists. You get access to medical care right when you need it. And so you can go, and that works at a private hospital. You can go in a public hospital, being a private patient. When it comes to like food and things, you get your own choice of menu, better food, things such as that. Where it seems like in the public system, I mean, you for certain surgeries and things, like you will like be put on the waiting list, and you will have to wait. It comes to you at no cost, but you do have to wait to be treated, is what it sounds like.
The outcomes for both systems have been quite good. Australians live longer than Americans, they're healthier, and they see their doctors more. They don't die of preventable diseases nearly as often as we do. And they get these results for less money, spending about half what we do per person.
That's insane.
Costs are kept low, partially because the government sets prices for drugs, treatments, and other expenses.
I agree with that.
But there's one major problem. Increasing numbers of Australians are choosing not to buy private insurance. People like Emily Maguire. She's a teacher, she's healthy, and she says the rising cost of living makes it hard to justify paying for a private plan.
And like the public health system is so great. Like they do a great job. So I'm just like, no, I think I'll trust them. And if I need something, then I'll pay for it myself. I'm not too worried. Yeah, it's a little bit about, I think, my values as well. Like I don't want to be paying for something that I'm not really getting anything from, if you know.
That's what I think. I agree with that. I feel like if you don't like really get sick often, or you don't have like a chronic condition where like, hey, like, you know what I'm saying, I need to get this surgery every so often, or like the one girl that they showed a minute ago where she has to get it every few years, so you know it's gonna come again, then I feel like there would be like no point in paying for private health insurance, because you know what I'm saying, you just don't necessarily need it since you have public health insurance and you don't get sick too much. You know what I'm saying? And like she said, if something ever did come up, I could just like pay out of pocket. So I feel like if you're just like someone's healthy, you don't have like any conditions or anything like that, then there wouldn't be a point in private health insurance.
Paying for something that I'm not really getting anything from, if you know what I mean.
An estimated 64,000 Australians dropped their private health insurance in 2018, and this creates what's called a death spiral for the system. Younger people, who tend to be healthier, have been leaving the private market, while older people, who tend to be sicker, have been joining it. Rosalie Viney says that cycle then perpetuates itself.
Private insurance holders tend to be those who are more likely to use private insurance, and so we see premiums start to creep up. associated with use of the care.
Remember, the private system is meant to relieve pressure on the public one. So now, the government is spending over $4 billion a year in subsidies to encourage people to buy private care.
Oh, wow.
And that cost keeps going up.
So what would be better is if we actually took a reinvestment of those private healthcare dollars and put it into our primary healthcare system.
I agree
Why
with
haven't
that.
we got this right?
Janine Mohammed.
I that sounds like it would be better. Yeah, because I think I can understand the younger people are not gonna do a private healthcare because that's more money out of pocket when you're overall in general a healthy person who doesn't have much problems. Whereas I feel like the older people, you do have to go more private healthcare because you need that treatment when you need that treatment, and so they're having to pay more because less people are paying for private health insurance and now there's more pressure on the public health system because that pressure is not being relieved from the private healthcare system. And so it's like I said, no system is perfect, so you just got to figure out that balance.
Mohammed has a very different idea of where those billions ought to go. She runs the Lowitja Institute, a research organization that advocates for better health care for Australia's Aboriginal and Torres Strait Islander populations.
How you been? Good.
People who have suffered decades of racism and discrimination.
Not bad.
Oh, wow.
So now we'll check your blood glucose levels.
On average, people from indigenous groups like Kylie Batiste suffer higher rates of chronic diseases than their peers. Mohammed says they die 11 years earlier on average than non-indigenous Australians.
It just seems ridiculous that those funds can't be redirected to Aboriginal Torres Strait Islander health when we know that we have the poorest health outcomes in Australia. So for us, it's giving the most privileged more funding.
Dr. Ashish Jha, Dean of the Brown School of Public Health and a collaborator with us on this series, says yes, there are significant problems here.
It's like ready, steady, cook.
But every nation's health system is a work in progress, and Australia has made important strides that the U.S. hasn't.
When we look across the world, we see lots of different systems that seem to work. They get universal coverage, good outcomes, reasonable costs, but they don't all look like each other. And there's a lot we can learn from Australia, from the UK, from Switzerland, all of which have very different systems from each other. But each of them can teach us specific things about how we can improve coverage and lower costs and improve outcomes for our own country. That's the key here, is to learn those lessons without worrying about importing any of these systems wholesale and trying to transplant them into the United States.
Oh, thanks, Papa D.
The members of the...
I do agree with that. Just being able to learn from so many different systems that had their statistics show better, like they're doing better than ours and paying less.
Dunn family have given up trying to convince each other that their healthcare choices are best.
Cheers, guys.
Cheers.
They're okay with the division.
And I was going to say, vive la différence.
For the PBS NewsHour, I'm William Brangham outside Sydney, Australia.
Yeah, the best. The best.
Yeah. And you can agree to disagree because, you know what I'm saying? Everybody's different and you're at different points in your life, and what works best for someone may not work best for another person. And so, you know what I'm saying? That's it. That's all we got, though. That was a good video. I feel like I did learn a decent amount from that video, and there are things we could take from Australia's healthcare system, and there are things we could take from many different healthcare systems, and we do have good things about our healthcare system. It's just that we're paying. It's so expensive. I think that's like the number one thing, is to just be able to bring that cost down. But that's all we got. You guys got a favorite video suggestion? You can subscribe to Patreon or drop it in the comment section. It's your boy Neal out.